Hello, I'm Janice Burns. I was a past anaesthetic education fellow at Cross Hospital, and Elizabeth, my colleague here, is the current obstetric education fellow at Whipps Cross. And we're here to present the Toast to Teamwork, which is the impact of team obstetric and anaesthetic simulation training on attitudes to effective teamwork. So I'm going to go through the background and the development of the Toast course, and then Elizabeth will take you through our pre and post course attitudes to teamwork questionnaires, as we on the last course we did as part of our course evaluation, and then some conclusions and discussion. So the obstetric emergency team and the labour ward team encompasses multiple specialties and disciplines, and then within each specialty there's multiple people involved as well, and of different levels. So the effective functioning of the multidisciplinary team in obstetrics has been a target for many national reports, including the maternal mortality report and Every Baby Counts. And the improvement of the multidisciplinary team has been cited as a particular area that we should be looking into, and quite frequently and repetitively it comes up. And the these reports basically recommend several educational interventions, and these include skills and drills training, and simulation in emergencies, and team training. But team training as the focus has not really been explored in obstetrics much, and so in response to sort of training needs in our hospital and as part of service development, we at the medical education team designed a course specifically focused on the obstetric team dynamics and training in our department. The Toast course is inspired by the Team Steps model to teamwork. So this is team strategies and tools to enhance both performance and patient safety. And the main premise is that teams that work together should train together. Now this obviously involves people being willing to do that, cooperation and communication, but teams that engage in it, if they know what their role is and what other people's role is in their team is, then they're likely to make fewer mistakes. And so Toast was developed locally to address some of these issues, and the idea is the multidisciplinary team learn team knowledge, skills and attitudes. It's basically a one-day course open to all members of the multidisciplinary team, and it's a mixture of workshops and simulation. So the first part is workshops. There are 5 workshops that go through what makes up the labour ward team, what teamwork looks like, or what is good teamwork. We use sort of a modified Delphi approach with the candidates to come up with their sort of top team qualities that they would like. Then we introduce them to the team steps model. There's a non-clinical team game, and then there's also workshops on the barriers to teamwork and the strategies and tools to overcome these. And throughout the workshops, we reinforce team training and dynamics, the integration of the OBS empty team members, particularly in the team game, and there's continuous debriefing to highlight examples of behaviour that's applicable to them. The simulation is the second part of the day, and there are 2 scenarios that involve some form of evolving crisis to the labour ward team, and also usually competing priorities of the different disciplines involved. And this is a chance for the team to deliberately practice these teamwork skills and behaviours that we introduced in the workshops.
Thanks. Okay, so I'm going to talk about the results. We did 2 courses so far. We've a total of 19 candidates, and we've got 18 responses. I hope this works. Yeah, so just looking immediately at our immediate feedback, I mean, it was overwhelmingly positive, and people like being trained, and people like team training. 95% of our candidates found that the course was very useful. 70% of the candidates found that they gained a better understanding of the roles, concerns, and expectations of other members of the team as a result of being on the course. But what we wanted to be able to sort of establish or understand was whether or not there was any impact on the candidates' attitudes towards teams. So we wanted to see whether we were able to, use the Kirkpatrick's model of team training evaluation and see that our initial feedback gave us level 1 response, the people like it. We wanted to see whether what was the changes to attitudes to try and get a level 2 response. So we embarked on using pre and post course questionnaires with our second course with 9 candidates. Now, the pre and post course questionnaires that we used were the attitudes towards healthcare team scale and the team skills scale. Now, these are validated questionnaires that have previously been used within healthcare teams. So looking at the first questionnaire, it's a 21 item tool with a 6-point Likert scale. And basically what it does is that it looks at candidates' opinions regarding teams. So team values, which is described as quality of care, team efficiency, which is labelled as cost of team care, and looking at the idea of shared leadership, which is described as physician centrality. It's used as a longitudinal monitor of attitudes towards team care amongst team members that are undergoing clinical team training programs, so specifically for people that have had team training. That questionnaire is used in conjunction with the team skills scale, and this is actually a self-assessment tool. So the candidates use this to assess their own interprofessional team skills. So this just sort of highlights what I've said with regards to the attitudes towards healthcare teams. So they start really by asking the candidates to, we'd like to know your attitudes towards interdisciplinary healthcare team and team approaches. Again, the reason why we use this scale is because it was specifically looking at interdisciplinary teams, and we know that this course is for a multidisciplinary team, so we thought it would be most appropriate. So, looking at more closely at some of the results, what we noted was the highest scoring statements pre-course. So interestingly, the highest scoring statements were around attitudes towards interdisciplinary healthcare teams and the team in 3 main areas. So the teamwork is linked to quality of care, team meetings fostering good communication within the multidisciplinary team, and teamwork being aiding the efficient discharge of patients. We looked at what the lowest scoring statements were, and it is important to note that even though they were lowest scoring statements, majority of candidates did actually agree with these statements. And these statements were looking at healthcare professionals working on teams are more responsive than others to emotional and financial needs of the patients. Patients receiving team care are more likely than other patients to be treated as a whole person. And developing a care plan with other team members avoids errors in delivering care. So those were the lowest scoring statements in the pre-course questionnaire. So because we did pre and post course questionnaire with this group of people, we were able to try and ascertain whether there was some change in attitudes towards teams or their attitudes towards team function. And we did find that there was change in attitudes towards team function, as well as the participants' views on how team function can affect the quality of care. If you look at the bottom column, that was the column that showed the biggest change. So the concept of the give and take amongst team members helps make better patient care decisions. So 30% of our candidates strongly agreed with this statement before they attended the TOAST course, and 78% of our candidates strongly agreed with the statement after attending the TOAST course. Other statements that show changes: patients receiving team care are more likely than others to be treated as whole persons, and developing a patient care plan with other team members avoids errors in delivery of care. So those 2 statements were 2 of the lowest scoring statements in the pre-course questionnaire. They showed the changes. They also showed some changes. Looking more into the results more, we've noted that there was also some changes in attitudes towards shared leadership. So the first column, a team's primary purpose is to assist a physician in achieving treatment goals for the patient. This actually is looking at the people that disagreed. So 20% somewhat disagreed with the statement, and 55% somewhat disagreed with the statement after the course. The second statement regarding physicians being natural leaders, 60% disagreed with this before, and 88% disagreed with this afterwards. I mean, these questions we think are pointing to the idea of physician centrality in the team, and the results suggest that in this cohort, the TOAST course changes their attitude towards keeping the physician's agenda as centred to teamwork. We also, like I said, mentioned we did the team skills scale, and this was a self-assessment, and we were asked the question that we saw the biggest change in was when asking the candidates to rate their ability to intervene effectively to improve team function. So 40% of candidates rated themselves as more than good pre-course, and 67% of candidates rated themselves as more than good post-course. And again, this would suggest to us that the candidates felt more empowered to intervene or participate actively within the team between before and after attending the course. So, some conclusions. So, we think that the TOAST course served to challenge our participants' frameworks and attitudes towards team working. Our results show that specific team-based training within the real multidisciplinary team does empower participants. And then with our results, we found that the biggest change came in attitudes towards team function with regards to quality of care and shared leadership. And we believe that learning is a social construct, and we think that we hypothesize that the success of courses like this is because it enables the participants to train within their communities of practice and also applies a social, cultural context. Training in teams that by allowing them to train in teams that they are regularly a part of. Traditionally, we know that training can occur, training happens within our professional silos, and we know that this course is aimed to try and overcome the barriers, professional barriers that we have. And by starting with workshops and identifying, key points to good teamwork, the key strategies to good working, to optimize the function of teams, we're able to then use the simulation-based training to apply those strategies that we've established in the morning, in the afternoon. We've shown some positive changes in attitudes towards how team work affects quality of care, ideas around shared leadership, and ideas around physician centrality. So there are some limitations. So obviously our numbers are small, and I think when we think back to what we were trying to achieve in terms of us being able to use the Kirkpatrick model of training to evaluate this intervention, it's very difficult to evaluate how higher up on this model. So we can show that people have learned something, we can show that people's attitudes have changed, but it's difficult for us to show what long-term behaviours we might find. We did consider, and we are still considering, the feasibility of doing observational studies in the clinical environment. However, working in the busy obstetric unit, logistically that can be very difficult, and also there'll be a lot of confounding factors, so it'd be very difficult to attribute specific changes long-term just to attendance. Moving forward, we are going to be taking the course to other trusts in the country to see if we're getting the same results, collecting more data and trying to make